hopefully, if there are any questions, I can always see people afterwards. My name is Juliet Gikonyo Nyaga. I'm the CEO of the Karen Hospital. The Karen Hospital was started in 2006. We are a 102-bed facility, and we're located in Karen. Now, the point of me showing this photo is, and the point down there is, come and visit us. If you've traveled from outside of Nairobi, if you've traveled from outside of the country, I'm not going to go through everything that we do at the hospital. Please take some time and come and visit us. If you want my information, it's at the exhibition stand here at the Expo Center. I'll be more than willing to host you over the next couple of days or even the weekend. Thank you. Karen Hospital is made up of 4 areas. One, we have the main hospital. We have our branches, we have a medical college, and we also have a Heart-to-Heart Foundation, which is our CSR arm. What we believe in, these are just some points that we as Karen Hospital staff are very key on, but I think I'd like to pull your attention to the third point, which is the quality and safety, which is very instrumental in terms of us delivering a medical tourism portfolio. Our flagship programs are many, and like I said, come and visit us, and I'll be more than happy to go through many of them with you. But of course, here in Kenya, in the region, we are known for our interventional cardiology and our cardiothoracic surgery program, which has been going on for the last 15 years. But our founders have been in the industry for the last 30 years, so we have a lot of history when it comes to cardiac care. And we'll be more than happy to show you our theaters, our main theaters, our cath lab unit, our ICU, and all the other areas that you'd be interested in as you send patients to us. The other area that I would like to discuss is around partner hospitals and institutions. It's important for you to know that we don't work in a silo. We actually work alongside other partners who send us already patients. But when we're looking at tourism, we're looking at 2 areas. One is local tourism, and the other one is regional and international tourism. These are our partners when it comes to local tourism, and the ones that we're currently working with in our various programs in cardiac, orthopedic, in neurology, urology, and the others. Training as a foundation to medical tourism. One of the things I want to talk about, and I think that needs to come out quite clearly, if we're sitting here as participants from Kenya, participants from Nairobi, from Bungoma, Kisumu, Mombasa, participants from Rwanda, Uganda, and other countries, one of the things I'd like to really focus on is training, because I feel like this is a backbone that we need to discuss more as partners to establish a better built medical tourism industry. At the Karen Hospital, we actually have quite a number of programs that we're running at the moment. And the reason I want to go through these is because I feel this is a foundation to the medical tourism. If I'm going to be receiving patients from Rwanda or Tanzania, I think it's important that you know that there are training programs, because at the end of the day, we cannot keep requesting for patients to be coming to Karen Hospital. We want to build the institutions and the partner institutions in other countries to be able to take care of their citizens as well. We have an internship program that we run for medical officers. We have a Cardiology Fellowship program training that we have just graduated our first cardiologist. We have a COSEXA program, which is, of course, is a regional program for surgeons. And at the moment, we're just going through what we call ESCOP accreditation, which is training for physicians. We also do weekly CMEs for doctors, and I really would encourage all of you to visit our stand and get more information, because you can actually participate with any link that is provided on a weekly basis. Here is Dr. Omondi, who is standing with our founders, Dr. Betty Gikonyo and Dr. Dan Gikonyo, and he's the most recent Cardiology Fellowship. Why are we so excited about this? Is because before this, all the physicians in the hospital who wanted to pursue cardiology specialization had to spend some time outside of Kenya. They would either go to South Africa, to India, to the US. Now we're saying that we are now receiving our accreditation through the medical board, which will allow us to be able to train the cardiologists in-house. What does that mean for the region? It means that even other budding physicians, other physicians in the area who want to be able to become cardiologists can actually look into coming to the Karen Hospital to receive this training. So you wouldn't be too far from home. The fellowship program has complemented our resident cardiac program, which we already have a full resident team, which has a cardiothoracic surgeon, has a cardiac anesthetist, cardiologists, cardiac nurses, and various other medical professionals who are instrumental in delivering our flagship program of cardiology. We also have other courses that we offer, a KRN, Kenya Registered Nurse Program, which is open, like I said, to the region, and also a operative theatre technology program. This is not unique to Karen Hospital. You can also find these programs elsewhere. However, the two that are unique to Karen Hospital and to Kenya and East Africa, to Kenya, is the one in higher diploma in cardiology. We actually train clinical officers on how to best do cardiac diagnostics. We've already graduated 16 people over the last 18 months who have gone to various counties of Kenya, and we're looking to see how we can do this for the players in the region. We also have the higher diploma in cardiac perfusion, which is a unique program also to the Karen Hospital to assist in training perfusionists who are instrumental in the open heart surgery that happens in various institutions. These are our strategic partners who we do research and training. That's another very important arm of our hospital. We do a lot of research and training. We've been able to do quite a number of international and regional publications, and currently we are even participating in 2 drug trials. This is obviously something that is new to us. We've only started doing it in the last 5 years, and we're looking to see whether or not we can build this program alongside regional partners such as yourself. So CSR as a part of medical tourism. Now, the reason I wanted to bring this up beyond training is we do have to take note of the fact that many of the people, especially children and adults who require heart surgery, can't afford it. So the question that we need to be asking ourselves is, when we do have patients, how are we going to take care of them? I just want to show you one of the ways we are doing it, and perhaps this can excite you into introducing CSR programs in your own hospitals, because at the end of the day, that is, we really need to be able to help most of the needy people in our communities. So we have the Heart to Heart Foundation program. This is actually a program that started back in 1993. It actually precedes the hospital, and it looks into raising money. We do various events and we raise money for children who require heart surgery, children under the age of 18, who have both congenital heart disease and also rheumatic heart disease. Once we get the money, we're able to actually do the procedures here at the Karen Hospital, but those few, probably 2 or 3% who are very high risk or very specialized cases, we do send out to other of our partnering institutions, especially in India. Over the years, we've been able to train over 10,000 teachers on how to be able to let me not use the word diagnose, but how to be able to look at children when they're students and see whether or not they have issues, and be able to then refer them to the nurses or the doctors of the hospital. We've also been able to train over 8,000 trainers of trainers, specifically community health workers, on how to better diagnose rheumatic heart fever, and doctors on how to better diagnose rheumatic heart disease. This is a photo of one of the young children that we recently did his surgery on, a young man called Sinto. I just thought it's important that you see, that there's a team behind it, but more importantly, you can see the smiling face of the young man who's holding the little car. We have a hot run coming up. Please allow me to take this opportunity. I told you I have to raise money for these children. So we do have a hot run coming up on June 18th. Please, if you are around, or if you can participate, or if you want to donate to the Heart Heart Foundation, please, I'm sure that you can get more information on this at our stand. So medical tourism at the Karen Hospital, as I wrap up. You can see here the next is that it takes a lot to put together medical tourism. Unfortunately, I know the writing is small, but I think these are some of the things that we have been looking into. One is accreditation of the entire hospital. We are ISO certified, 15189, 2012 for the lab accreditation, and 9001 2015 for the entire hospital. And I think that's very important if you really want to look into medical tourism as a facility on your own. What kind of levels of accreditation can you go into? Multidisciplinary team is important, excellent clinical outcomes, and then also looking at quality indicators and how you can ingrain them into your clinical protocols and so on. The other area, of course, is availability and transport. I think some of the things that we have to think about even as a country is how do you get people from the airport or other evacuation sites very quickly to your hospital if you really want to be known as a medical tourism center. One of the things that we were able to do when building the hospital is ensure that we have an area where a helicopter can land, and we've had several evacuations, which has really been important to saving the lives of the patients. The other areas around TK is around packages. People want predetermined cost of care when it comes to seeing their patients, and we're happy to know that these are just some of the ones that we've been able to develop. There are many, many more, but I thought it would be hard to put all of them on one slide. But we do have packages. So it means that when you're sending a patient, we're already able to tell you what that price is going to be and therefore what kind of funding you'd have to look into. Local tourism, like I said, we look at tourism in two facets, local and regional. One of them is local tourism. We have 9 branches here in Kenya. What we have done is that we've been able to take specialty clinics out to the various centers, especially around urology, general surgery, and orthopedics. But our flagship program, the cardiac program, we actually carry out a cardiac clinic in each and every one of our satellite branches at least once a month. In some centers, we carry them 2 or 3 times a month. However, what we've done is that we've built the capability of the staff in the clinic to be able to carry out at least a basic ECG and a basic echo. What we've noticed is that the referrals that come from the various centers, we are able to actually take care of them within the main hospital, whether it's a cardiac surgery or cath lab intervention, up to 98%. And that for us is one of our big wins. So we've come out to be one of the busiest cardiac centers in the country and the region, and we hope to grow more in the future. Lastly is international medical tourism. We've been able to see patients from all these various centers. We've actually been able to train cardiologists from Gambia, from South Sudan, from Egypt, Rwanda, Burundi, and Uganda. We've also held cardiac camps in Nigeria, Goma, DRC, Burundi, and Tanzania. And we've held actual physical doctor CMEs in Ethiopia, Uganda, Rwanda, Burundi, and Tanzania. I'm just trying to show you that we really do want to come to the various countries. We want to be able to do some education and training to build the capacity of those countries, because at the end of the day, we want medical tourism to be beneficial for all of us. Lastly, we have a medical tourism desk who will be able to take care of all your needs to make sure that your patients not only arrive safely, but are actually comfortable and taken care of during their stay. And also, when it's time for them to leave, they'll also receive the necessary assistance. Thank you very much.
Thank you so much, Dr.